Hi, my name is Claire. I'm going to be your nurse today. I'm just going to be doing a complete physical assessment on you. Can you just verify your name and date of birth for me, please?
Yeah, Gabrielle Kazon, 11/14/96.
Okay, and do you have any concerns before we start?
No.
Okay, awesome. So can you just verify where we are right now?
At Katie,
And the year?
2017.
Okay, awesome. So the patient is alert and oriented ×3. She was able to tell me person, place, and time. I also took her vitals before the video, and they were within normal limits. So just upon inspection, her height and weight appear normal for her age. She doesn't have any obvious physical deformities, and she has appropriate dress for the situation as well. So now I'm just going to take a quick look at your skin. Upon inspection, it looks to be free of lesions. A normal and consistent color throughout. So now I'm just going to touch it and palpate it a little bit. I'm going to use the back of my hands for this. And the temperature feels normal, equal bilaterally, and the skin feels smooth and firm. So now I'm just going to test her skin turgor. So I'm just going to pinch a little bit of skin under your clavicle. Okay, and the turgor feels good. Do you have any history of skin disease in your family?
No.
Okay, awesome. So now I'm just going to take a look at your head. Upon inspection, the hair seems to be straight, black, even throughout the scalp. I'm just going to palpate your head real quick. And the head feels normocephalic and free of any lumps or anything like that. Now I'm just going to check your TMJ. So I'm going to touch your face right here. And can you open and close for me? Okay, so the motion of the TMJ was smooth with no crepitation or any limitations. Can you clench your jaw for me? Okay, so that shows the intactness of cranial nerve 5, or the trigeminal nerve. And can you lift your eyebrows, close your eyes, open, smile, puff out your cheeks, and stick out your tongue? So all of those showed the intactness of the facial nerve, or cranial nerve 7. And if you can just close your eyes real quick and tell me where you feel this sensation.
Cheek, chin, forehead, cheek.
Okay, so that also shows the intactness of cranial nerve 5, or the trigeminal nerve. Now I'm going to look at your nose, and on first inspection it appears to be symmetric and midline to the face. Can you close one nostril and breathe through it? And then the other one? So this shows patency of the nostrils. And if you can just tilt your head back, I'm going to look inside your nose real quick. Okay, so the nasal mucosa are a normal red color, and they have a smooth and moist surface, and there didn't appear to be any perforations or benign growths on the inside the nose, and no septal deviation either. So I'm just going to check your sinuses real quick. I'm going to touch your nose. So these on top are the frontal sinuses, and these are the maxillary sinuses. Any tenderness? Okay, perfect. So now I'm going to look at your eyes real quick. Just on first inspection, the eyebrows are symmetric and normal. The eyelashes cover the whole eye. There's no protrusion, and they look equal bilaterally. So I'm just going to check your conjunctiva. Can you look up for me? And I'm going to touch your face real quick. Okay, so the conjunctiva appears white and moist and clear. The iris is round, and it's brown with an even coloration. So I'm just going to test your visual acuity real quick. Can you cover one of your eyes for me? Mm-hmm. I'm going to give you this little eye test. Okay, and just hold it like, yeah. Okay, so can you tell me line 5?
D, C, E, F.
Okay, and then can you cover your other eye and tell me line 7?
A, B, C, D.
Okay, so that shows that the patient has a 14 out of 14 vision and good visual acuity. So now I'm just going to test your extraocular muscles. Can you follow my finger, but don't move your head? Okay, so those are the 6 cardinal positions of gaze, and that shows that her cranial nerve 3, 4, and 6 are all intact. And now I'm just going to test your pupillary reflex real quick. Can you stare off into the distance? And I'm just going to shine this light in one of your eyes. Okay, so it looks like there was constriction on the side that I shined a light, and also the other side, and the constriction was equal bilaterally. So now I'm just going to test your accommodation. Can you follow my finger? So her accommodation looked normal, so that's good. And then I'm going to use the ophthalmoscope to look inside your eye and perform the fundoscopic exam. Okay, so the optic disc looked to be a creamy yellow and orange. It had sharp margins with no visible lesions, and the macula looked to be the same color, a very even color. Okay, so now I'm going to look at your ears. Inspection, they look equal bilaterally. The top of the pinna looks to be about equal with the eyebrows. And I'm just going to palpate them real quick. Any tenderness or pain?
Nope.
Okay, so the pinna and tragus, there's no tenderness upon palpation. Can you turn that way so I can do the whispered voice test? Okay, I'm going to say 3 numbers. Can you just repeat them after me? 4,
475.
Okay, and then I'm going to do the other ear.
10, 12, 14.
Okay, so the whispered voice test was good, and that shows the intactness of cranial nerve 8, or the acoustic nerve. So now I'm going to look inside your ears real quick, and I'm just going to be pulling the pinna up a little bit and back, and looking at the tympanic membrane, which appears to be pearly gray in color and intact with no perforations or anything like that. So now I'm going to look inside your mouth real quick. Upon first inspection, the lips look to be moist with no cracks. So I'm going to look inside, and the buccal mucosa looks to be pink and moist with no lesions. The teeth appear to be clean and even and straight. And can you say "aw" for me real quick? So when she says "aw," the uvula and the palate rise symmetrically in the midline, which shows the intactness of the vagus nerve, or cranial nerve 10. And I'm just going to test your gag reflex real quick. Okay, and that was intact. So all of those tests showed the intactness of cranial nerves 9, 10, and 12. Okay, so I'm going to look at your tonsils. Can you open your mouth for me? And they look to be a healthy pink color and a +1, which shows that the patient is healthy. So now I'm going to take a look at your neck. It seems like it's in a midline position. Her head is upright. Can you touch your chin to your chest for me? And to the sides, then back. Okay, and then I'm just going to have you press against my hand, and to the side, and back. Okay, so she has full range of motion in her neck, and the strength was a 5 out of 5. And now we're going to test the spinal accessory nerve, cranial nerve 11. Can you shrug your shoulders? Okay, so that was intact as well and equal bilaterally. So now I'm just going to palpate your trachea right here. Upon inspection, it appears to be midline, and upon palpation, it also appears to be midline with no bumps or anything like that. And if you can turn that way, I'm just going to palpate your thyroid gland real quick. So you can tilt your head to the right. And I'm just going to displace the trachea so I can palpate. And can you swallow for me? Okay, and then the other side. Swallow. Okay, so the thyroid gland was not palpable, which is normal. Okay, now I'm going to palpate your lymph nodes, and I'm just going to use a circular motion for that. So I'm going to start with the preauricular, postauricular, occipital, posterior cervical chain, anterior cervical chain, submandibular, submental, and then can you shrug your shoulders? And the supraclavicular, and none of those are palpable, which is normal. So now I'm just going to look at your anterior chest. Normally for this part of the exam, she would take her shirt off, but she's just going to leave it on. So upon inspection, there's no lesions, discoloration, nothing that looks abnormal. Her breathing looks unlabored and even on both sides. And also her AP diameter appears to be less than her transverse diameter, and there's no visible pulsations. So now I'm just going to palpate your axillary nodes. Can you raise your hand for me? Sorry, this might tickle a little bit. Okay, and the other one. So those were non-palpable as well. So now I'm going to start auscultating your lung sounds. So can you take a deep breath for me every time I move my stethoscope? And let me know if you start to feel lightheaded at any point. Just 2 more. Okay, perfect. So all the lung fields sounded clear, and there were no adventitious sounds over those. So now I'm going to check your tactile fremitus. I'm just going to do it on your back. And can you say 99 for me?
99, 99, 99.
Okay, so the vibrations from one side to the other appeared to be even. And that was normal. So now I'm going to listen to your heart sounds real quick. Okay, so we're going to start with the aortic, pulmonic, Erb's point, tricuspid, and mitral. So S1 and S2 were present over all 5 cardiac areas, and there were no extra heart sounds or murmurs over those as well. So now I'm going to check your back, or the posterior lung field. So can you face that way for me? Okay. So upon inspection, the skin is also clear. The spine is a little curved from scoliosis that seems to have been corrected by surgery. So can you just take a deep breath for me? This is checking for equal chest expansion, which it seems that the chest expansion was equal and symmetric. Okay, so now I'm going to test for CVA tenderness. So just tell me if you feel any tenderness. Okay, so there's no CVA tenderness present. Now I'm going to listen to your posterior lung fields. Like I said, let me know if you feel lightheaded at any point, and just take a deep breath when I move my stethoscope. Okay, so the posterior lung fields, the breath sounds were also clear to auscultation with no adventitious sounds there either. So if you can lay down real quick, I'm just going to look at your abdomen. Okay, do you mind lifting up your shirt?
Mm-hmm.
So upon inspection, it appears to be an even color, no lesions or any thing that looks abnormal. There's a visible pulsation at the aorta, and the skin is intact, and it's a flat contour. So now I'm just going to auscultate your abdomen. And I'm going to start in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. So her bowel sounds were high-pitched and gurgling, which is normal for the bowel sounds. And now I'm also going to listen for bruits over your abdominal arteries. And for this, I'm going to switch my stethoscope to the bell side. So first, I'm going to listen to the aorta, then the renal arteries, then the iliac arteries, and the femoral arteries. Okay, so it didn't appear that there were any bruits over those as well. So now I'm going to start with percussion, and we're going to use the same order that we did before, starting with the right lower quadrant. So it appears that tympani presides over all 4 quadrants, which is normal. Now I'm going to do some light palpation in the same order again, starting with the right lower quadrant. Moving up to the right upper quadrant, left upper quadrant, and left lower quadrant. Was there any tenderness there?
No.
Okay, so now I'm going to do some deeper palpations to assess for masses. Again, moving in the same order. Any tenderness? Awesome. So now I'm going to palpate for specific structures. First, I'm going to do the liver in the upper right quadrant. Can you take a deep breath for me? Okay. So liver, it appears to be 7 to 8 centimeters, which is normal in a healthy patient, and it has a smooth border. So now I'm going to palpate for the spleen in the left upper quadrant. Can you take another deep breath? Okay, perfect. And it doesn't feel like that's palpable, which is also normal. And now I'm going to palpate in both upper quadrants for the kidneys. Can you take a deep breath? Okay, those were non-palpable as well, which is also normal. Okay, if you can sit up for me, I'm just going to check your vascular system real quick. Okay, can you tilt your head to the side? Okay, so I'm not seeing any jugular distension, which is good. Can I check your fingers real quick? Okay, there doesn't appear to be any clubbing or spooning of the fingernails or toenails, and her capillary refill, is good on the fingers and toes. It's less than 1 second. Okay, so I'm just going to check your various pulses real quick. So we're going to start with the carotid. Then we're going to move on to the brachial, and I'm checking these to make sure they're even bilaterally. Now we're moving on to the radial, the femoral, okay, and the popliteal. The posterior tibial, which is on the inside of the ankle, and the dorsalis pedis on the top of the foot. And All of her pulses were 2+, and they were equal bilaterally, so that's good. Okay, so now we're going to do some neurological tests. We're going to start with the testing the intactness of the cerebellum. So can you do your hands like this for me on your lap really quick? Okay, perfect. Can you do this with your fingers? Okay, so good. Those showed that the cerebellar function was intact. So now I'm going to do one more test for cerebellum. So this is, can you stand for me? This is called the Romberg test. So can you close your eyes? Just stand there for about 10 seconds. Okay. All right, you can open them. Perfect. So I didn't see any swaying, which was good. It shows that she has cerebellar function intact, and that's called a negative Romberg test. So now I'm just going to have you walk towards me. Okay, and back. All right, so her gait looked smooth, rhythmic, and effortless, and so that's good. And you can sit down again. Now we're just going to do some sensory tests. Can you tell me when and where you feel this sensation, and close your eyes?
Leg, hand, face, arm.
Okay, perfect. So her light touch sensation is intact. So now I'm going to test your deep tendon reflexes, starting with your brachial reflex, which is in the arm. I'm going to support it like this. Feel for the tendon. Use my stethoscope. Okay, good. So those were equal bilaterally. Now I'm going to do the brachioradialis, which is closer to the wrist. Those were also equal bilaterally, and now I'm going to do the tricep, supporting her arm. And those looked good, also equal bilaterally. Now I'm going to do the popliteal, which is the knee. These are equal bilaterally as well. And then I'm going to do the ankle. Can you cross your leg for me? And I'm going to hit her on the Achilles. And the other one. Okay, good. These appear to be equal bilaterally as well. And all those were about 2+ reflexes. So now I'm going to do the musculoskeletal exam. Can you lay down for me? Okay. Can you lift this leg up, bend it, and then rotate your hip in and out? Perfect. And then the other leg up, bend, rotate in and out. Okay, perfect. So it appears that her hips have a full range of motion, and now I'm just going to check your strength. Can you lift against me? And then this way. Okay, another one. And then against me. Okay, so the full range of motion in the hip and equal strength, 5 out of 5 bilaterally. So can you sit up for me real quick? I'm just going to test your lower extremity strength. Can you straighten your knees for me? Okay, and against me, and then back. Okay, perfect. And then your ankles, to circle them. Okay, so she appears to have full range of motion in the lower extremity as well, and 5 out of 5 strength bilaterally. So now I'm just going to test your upper extremity range of motion and strength. So can you stand up for me? No. Okay, and then can you circle your arms like this? Put them behind your head, behind your back. Okay, good, and put them forward and backwards. Okay, and then I'm going to have you pronate and supinate, so like this, and then turn them. Okay, perfect, and then do your wrists like this. Okay, so she appears to have full range of motion in her upper extremities, in her wrists, and everything like that. Now I'm going to do the carpal tunnel test. So can you bend your wrists like this and push against each other? No tingling or anything like that? Okay, so that's a negative carpal tunnel test. So that means the wrists have full range of motion. So now can you just press against my arms? And then this, and then up, down. Okay, so she also appears to have full strength, 5 out of 5 bilaterally in her arms as well. So now I'm just going to look at your spine real quick. Can you turn around for me? And can you touch your toes? Okay, so like I said earlier, her spine is a little bit curved. You can stand up. From what appears to be scoliosis that was corrected with surgery. So can you bend the sides for me and forward and back? Okay, good. So she has a little bit of limitation of motion because of that scoliosis, but other than that, everything appears to be normal. So that concludes the physical exam. Thanks for coming in, and let me know if you have any other questions or anything abnormal seems to come up.
Thanks.